The subject that we're talking about, there's no other way to put it except just call it as it is. Let's call it assisted suicide. Suicide, again, without a negative connotation, is we're relating to something different because we're saying the word assisted, which means helping someone to die. You know, if you see somebody crossing the street and they're having difficulty, you might walk over and help them across the street with their groceries or their bags or their cart. You might push their wheelchair for them or help them with their walker. Isn't that assisting someone? So we looked at different opinions. We looked at the Shulchan Aruch, at the Mechaber, at Rav Yosef Karo. We looked at Rav Moshe Isserlis representing the Ashkenazi authorities. We looked at the poskim that comment on the Shulchan Aruch, the Shach and the Taz. And we established that you're allowed to do, according to the Shach, who was from Poland, and one of the commentaries, you're allowed to do whatever you want. By the way, whenever I give a class like this, you should know, for a 1 hour class, it takes at least 3 hours of preparation. So I learn every time I teach something. It's pardon, Rochama, am I right?
Absolutely, absolutely.
It's not like I can just, believe me, I'm not that brilliant. If I was that brilliant,
ללמוד וללמד.
ללמוד וללמד. If I was that brilliant, I would just sit here off the cuff and just say it all to you. But I have notes I have to prepare, and it's so. I find that what we were looking at was you're not allowed to. You can do whatever you want as long as they said, as the Shach said, and by the way, Rambam agreed with this. You're not allowed to move the body. Now that's what I left us with, but what does that mean? We said, well, in the old days, in the times of the Talmud, they would put to help someone not concentrate on the pain that they're having. Let's say they had, I don't know, let's use the example, shoulder surgery, which probably didn't even exist back then, but let's say. So they wanted to take the person's mind off the pain of the shoulder surgery. So they would take a salt cube and they'd put it on the person's tongue. And that was a way of the person's mind leaving the idea of the pain. It's like the old joke. I'd say to my father, and I'd say, oh, I twisted my right ankle, it hurts. And he said, well, come here, I'll kick the left one and you'll forget about the right one. You know what I mean? Like, so if you have salt on your tongue and it's burning a hole in your tongue, I mean, we wouldn't do that today. Then all of a sudden you're not thinking about the pain in your shoulder. You're thinking about the tingling on your tongue, the tingling. So, whatever it is, you have a pain or an ache and it goes away for a day and all of a sudden you forget as if you never had it. Well, what does that really mean? You can do whatever you want as long as you don't move the body. Because we know that in today, whatever hospital you go into, all of a sudden they go, oh, we now have a private room available, or we have a semi-private. We're going to move you. Your coverage covers you for a semi. So we're going to take you out of the ward of the 4 people and we're going to move you. Or if the person is really a goses, and we use that word goses, meaning someone who is inevitably going to die, and they use that word meaning very soon, because I guess from the day you're born, you could be saying eventually we're all going to die. But a goses is someone who is inevitably going to die, and no medical intervention is going to save this person. I suppose that's why we stage cancers, for instance. We have stage 1, stage 2, stage 3, stage 4. Often, not always, because we also have clinical trials. We are a people of hope. We are a human, and we try everything we can to try and keep people alive and comfortable, and that we should have longer lives. But there is, in medical ethics, forget about Judaism, forget about Halacha, forget about law, just in the doctor's code of ethics, they look at things and they say, you know what? If the tumor is over a certain amount of centimeters, whatever that might be, 4 centimeters, and they say, well, the person doesn't qualify for this trial, or they don't qualify for this, or they don't have that. It's got to be under a certain centimeter for a tumor to be in order for someone to receive medical treatment. So that could be considered a stage 4. In which case they say, we're not going to do things to try and save the person. We're going to do what we can to keep that person comfortable. This is really a delicate balance. So moving the body means when they want to move a body from room 141 to 143, because the person might be more comfortable 143, what does it mean? The person's dying. We're not allowed to move the gurney. We're not allowed to move the bed from here to there. Rabbi Fink taught us something is interesting. You know how we always talked about, it doesn't matter whether we're talking about kashrut or technology or whatever it is. And we're going to go back to technology later on also, because there's other things. One of the things that we talked about was doing things with a shinui, a twist, a change. When we bury someone, we use the back of the shovel first. Why? Because it's a shinui. It's a different way of doing things. We don't use the front because we want to express that shoveling to bury someone that we love is not the usual way of shoveling. It's not we're not like gardening. It's not like we're planting tomatoes. It's lichvod hamet, in honor of someone who has died. So we say this is a difficult way. We don't want to shovel normally at the beginning. We're going to use the back of the shovel. The shinui is symbolic to say this is different. There's something different going on here. Well, if there's something different going on, for instance, you have no choice. It's 110 degrees in your apartment. You need the air conditioning on, and it's Shabbat, and you don't want to violate Shabbat. For most of us, we'd say, who cares already? Just turn on the air conditioning. Why suffer? You have to enjoy your Shabbat. But somebody who was very worried about violating Shabbat would say, I normally would just take my finger and push the button to cool, and it'll come on. Somebody who's really worried would say, I'm going to do it, but I'm going to do it with a shinui. I normally use my right hand and my index finger. I'm going to use my left elbow to nudge the button over. And by using your left elbow, that's called a shinui. The same thing happens when you go to move that bed. If someone is a goses and you need to move the bed, you can't gently just take the bed and slowly move it. We don't want to disturb the patient. We're going to just glide it quietly along the floor and move it into the next room. No, you can't do that, because that would be considered like taking the pillow away from under their head gently so their head lies flat, so they will die quicker. That's causing someone to die quicker. You're not allowed to do that. So how would you move the bed? You would just, I'll tell you what the answer is. You move it, I'll use the word violently, but we know we wouldn't do that. You just take the bed and you just move it. Even if it jerks the bed a little bit, even if the patient goes, oi, it's okay. Just move the bed. Why do it like that? Because that becomes a shinui. Normally, if someone was doing okay and they're fine and they just have a broken shoulder or they had a back surgery, they're not dying. They just had a broken shoulder or a back surgery. It's not just. I'm not belittling the back surgery or the shoulder surgery, but whatever it isn't life-threatening. You would gently move the bed. You wouldn't jerk the bed of someone who just had shoulder surgery, because that would be considered being mean-spirited. We don't do that. But in this case, the person's dying. They are considered a goses. So you just grab the bed and you move it, even if the person goes oy vey. Why? Because that becomes the shinui. That becomes a different way of normally how you would move the bed. That would not be considered helping the person die. It becomes the opposite. By moving the bed like that, you're stirring the patient. You're even doing the opposite. It's a complete opposite way. It's not the way we would normally do it. And we talked last week or 2 weeks ago, whenever we were together, about a Rav called Rabbi Yehuda Fatia. And he is known as the Perush Beit Lechem. He said that it's forbidden. Remember, you'll probably remember this because we talked about this. It was forbidden to push off death of the patient. You're not allowed to do anything that's going to lengthen the life of the patient. Well, so we're talking about someone who is just about to die. If you're administering medicine, you're giving them medicine and it's keeping them alive, then you have to step back at some point and say, you know what, we have to let this person die. It doesn't mean that we have to let them die in pain. We can do what we can to keep them comfortable, whatever that's going to mean, whether it's morphine, whatever medications we're going to give. But the Torah says, and Rabbi Fink taught me this, and I wrote this in bold in my notes. He taught us in the class that in Parshat Mishpatim, we go back to this, and we talked about this all the way back when it came to abortion, when we spoke about a rodef nefesh, a rodef ala nefesh, someone who is pursuing the woman's life. We said then it would be permitted to destroy the pursuant. And he used this example about the two guys that are fighting and one hits the other one and injures him, and the bad guy is injured and the neighbor has to pay compensation and et cetera, and the cost. Well, if you're not required to risk your own life, remember I said about the river, the guy's flowing down the river, and I said, you don't know how to swim. I gotta tell you, I'm a terrible swimmer. I don't like deep water. When I go in a boat, I wear a life jacket. I would wear two of them if I could fit them on. I like being on the water, but I'm not such a great swimmer. So I look at it as, if I don't know how to swim, am I going to jump into deep water? I'll probably die. I'll probably drown. That would be not the correct thing to do. But I'm supposed to go and run and look for a pole, a stick, or something to put out anything, a life vest, a rope, tie it onto a life jacket and throw one of those rings that you throw out, whatever it is, anything that you can do to help save that person's life, you're supposed to try and do it. But not at the risk of risking your own life. So the Torah says to us that the perpetrator, that person who hit the other person, is responsible for all of the medical costs. Well, that understanding would mean whether it is the simplest drug, Tylenol, aspirin, I don't know, codeine, whatever the medicine is, or whether it's even the simplest dental procedure that the person's having. You punched him and you knocked his tooth out. If a person has to have dental surgery, there is a risk of injuring the patient. Well, we take it for granted. We sit in the chair, we open up our mouth, and we just trust that the dentist froze everything and he's going to drill us and he's going to do everything great. But it's possible. The drill slips, he's getting older, his mind was on something else, he injured us, things happen. So the Torah had to give us permission. The Torah had to give us permission to inflict pain on a suffering patient in order to save their life. Well, isn't it true? Nobody says, I woke up this morning, I feel like today's a good day for a drilling. I don't need it. I'm going to go to the dentist and get my teeth drilled. Nobody does that. Or nobody says, today's a good day for a shoulder surgery. My shoulder's fine, but I just feel like it. I never experienced a shoulder surgery, so I'm going to ask if they'll give me one. You'd be nuts, right? So, and they wouldn't even do it. When you cut somebody open or you perform surgery, there is always a risk. They have to put you under. You might not wake up. You know what happens? Anesthesiologists, it's not their mistake. It's that things happen. And whatever you're doing, normally we would say, I'm laughing because it's the complete opposite of what I just said. We say, do it gently and be careful not to move the patient. That's what we learned from the Perush Beit Lechem. Do it carefully so we're not moving the patient. The patient's a dying patient. We're not allowed to move them. because they're a goses. But in the case where you have to move the patient, then you don't do it carefully. That would be the shinui. That would be the difference. You just do it abruptly and do it. So
But who decides that he is a goses?
who decides who the goses is? Well, Rambam decided. Do we trust the Rambam? Okay, so it's a good question, Rochama. You know, the tour. I mean, the Machaber. So Rav Yosef Karo. I don't know. Maybe there's a case somewhere where he didn't agree with the Rambam, but probably 99.5% of the time he agreed with Rambam. Rambam said that if somebody is going to die, inevitably, meaning that he said that in the old days, in the 12th century, 13th century of Rambam, you couldn't get on a subway and go and visit somebody. We couldn't get on an airplane and go to Cleveland or Chicago or Eretz Yisrael to visit somebody. We had to take long travels. You packed up your donkey or your camel. Maybe you got lucky and you had a talking donkey like last week, but you took your donkey or your camel and you packed it up, or your horse and your buggy and your water and your food and all of your needs for your 3-day or 4-day travel, or 3-week or 3-month travel to get there. I drive to North Bay in 3 hours on a double 4-lane highway. When I was a kid, it was a 5-hour trip because it was 1 lane up and 1 lane down, and you had to go through small towns and slow down. Before my time, and they had those Model A4s or Model T, whatever they are, cars, they probably went 30 miles an hour and it took them 9 hours or 10 hours or 12 hours. Before that, they took a horse and it took them 3 days. Before that, they had no dirt roads and they had to cut themselves through the woods and it took them 6 months. We've evolved. Rambam says, when you go to visit somebody and you see with your own eyes that that person is dying, you can see they're dying. You don't know when. Only the Rabbono Sha'olam knows. Rochama, you taught us that the other day. You said those words. You said, we still can say a Mishaberach for someone who we know is dying. You said, because only God knows. See, I remembered what you said. I didn't forget. So the answer to the question is, Rambam says, if after you leave, that person, you don't know, are they going to die in 1 day, 2 days, 3 days, 4 days? So you're on your travels. There's no telephone. I can't pick up my iPhone and phone him up and say, hi, are you still alive? So I don't know. I don't know. After the 3rd day of travel, you're allowed to do Kriya and start sitting Shiva. And that's in the Talmud. Because on the 3rd day of travel, you wouldn't even receive a letter by mail in 3 days. So it was assumed someone who was determined to be dying had to be viewed. And we have to trust our medical professionals today. And the Rabbanim of today, Chazal teaches us that we're not allowed to rely on any of the medical practices in the Talmud. It's interesting. You would think that these giants and the rabbis in the Talmud that wrote down, you can do this and you can do that and you can have this special concoction and this formula and this tea and all that. We're not allowed to do any of that anymore. They don't want us to try to do things that are like considered to be magic. And we're supposed to trust our medical professionals, and medicine has evolved and become much more sophisticated in our time. I mean, certainly I've seen big changes And many of you are probably even 2 or 3 years older than I am, and you've probably seen many more medical advances than even I've seen. And so we all, the eye in Kohelet, it says the eye never has its fill of seeing, right? Whether you're old or you're young, you never see everything. You're always going to miss something. But we have to trust in our doctors. These doctors, by the way, according to Chazal, according to our rabbis, are only able to do what they do because of God. That's how they get around it. They build a fence protecting the doctors by saying the doctors have an ability to perform surgery or medical treatment. And we don't even call them in the days of the Talmud doctors, we call them healers, right? Rofei, healing. Those professionals, and that's why we allow, by the way, alternative medicine as well, because many of alternative medicine was already discovered in the time of the Talmud. So whatever works, whatever treatment can help somebody, we are supposed to try and do, unless the person is deemed by the healer, as someone who is going to die no matter what treatment we do. It doesn't matter what we're going to do for this person cannot survive. So we're not allowed to prolong a patient's life if they're dying. You're not allowed to do that. If they started a treatment course, whatever that course is going to be, and it turns out that all of the treatment is doing, all it's doing is prolonging the suffering, it's not helping them get better anymore, then you have to remove the medicine. We see it all the time with chemotherapy, where doctors, oncologists will say, this cancer treatment is not working anymore. Things are advancing. We are going to stop that treatment. If you are prolonging the suffering with a ventilator, and I know Lawrence will argue this, I'm not saying that I agree with it or don't agree with it. I'm just telling you what the Perush Beit Lechem, with his opinion is. Do it gently. Be careful not to move the patient and remove the ventilator. And many poskim would say, no, hold on 1 second. I have to take this call. I have to put you on mute for 1 second. This is. Okay, so we're just talking about a goses, and that was a phone call from the funeral home of one of our members that passed away. So you see, right in the moments of talking about death and dying and assisted dying, it's part of life. It's what happens. So if everything that these rabbis are basing their opinions on start with Rambam, with Maimonides, you know, we always talk about the Shulchan Aruch, but they're writing opinions and laws and decisions and judgments and things that interpret really what Rambam is saying so we can understand.
Yes, because Rambam was a doctor also.
Correct, as among many other things. But sometimes we have to adapt the laws to today, because Rambam was a doctor at a time when medicine was practiced differently then than it is today. I don't mean the part about the treatment of a patient in terms of how we handle the patient, but in terms of the medical practices, the medical procedures. Rambam probably wishes that he was able to have ventilators and equipment that we have today. He didn't have it. So understanding that a medicine that's being administered has to do something for the patient. It has to be helpful. You can't just say, if you are giving a clinical trial, you're opening up the clinical trial for the patient, you have to have one element of hope in there, and more than hope, you have to have an element of science. You have to have an element of science, something to back it up to say, it is possible that this treatment will help this patient. And if there's that element, and the doctors say that, then it opens up a door to risk as well. For instance, morphine. Morphine helps to relieve pain. We know that. Someone is suffering, we give them morphine. On the other hand, we talked about how it has other effects on the body that can really, in a sense, help the person to be dying. It could slow down respiration. It can lower the ability to breathe, et cetera, et cetera. Those are all things we talked about. Now, I promised you, and I have to start right now because we have a half an hour, right? Well, that's good. We have a half an hour still? What time do I have till? 10:15? Okay, good. Baruch Hashem. Let's move forward because that's recapping. It's been a couple of weeks since we were together. Assisted dying or assisted suicide is correct if we're talking about passive euthanasia. That's not Marshall Loomer talking. That has to be defined by our posky, by our rabbi. So it means refraining from anything that will prolong suffering. Not only is it correct, but it's reasonable. That's what the Beit Lechem Yehuda taught us. But don't do anything to push off death if it's a terminal patient. Now, who are our modern poskim that we look to? So when I did my research, I looked towards the Aruch HaShulchan, Rav Michael Epstein, Yechiel Michael Epstein, because he's 20th century. He published the Aruch HaShulchan, not to be confused with the Shulchan Aruch. The Aruch HaShulchan was almost abandoned by most yeshivas for a long, long time. They looked at it and said, what do we need the Aruch HaShulchan for? We got the Shulchan Aruch. He's just another outsider. Now it's regarded differently because he has some different opinions that are being considered today. And his daughter, Brina, tried to help to publish it and get things started. And I mentioned this, I think it's an interesting footnote, is that when she tried to republish her father's works, she had her own name in it, and yeshivas didn't take it seriously because it had a woman's name in it promoting it. What do we want to buy a book that has the name Brina in it? We're not going to buy it. Once she changed that and she used her husband, he was a rabbi also, put his name in it, all of a sudden it took off and became, it's a chauvinistic world, unfortunately still, but we're getting better, I hope. So the Aruch HaShulchan, in the beginning of the Masechet Smachot, so Masechet Smachot talks about what is Smachot. Smachot is happy occasions. He says that if we look at the material that comes from the whole Talmudic period, but really wasn't edited until after the Talmudic period. Someone who is about to die, maybe this helps, Rochama, this might help answer your question. Someone who is about to die has the status of being 100% alive. It's interesting, right? Just because someone's about to die, they're not dead, they're still alive. So someone who has a status, who is considered right at this very moment to be 100% alive, as far as every halacha is concerned, every Jewish law, you're not allowed to do anything to hasten their death. But this in the Mishnah says that anyone who moves any part of the patient's body while they are dying is the same as someone who is killing someone, shedding blood. Wow, that's a serious. See, all of a sudden Esther woke up, because you see, this is an interesting statement by the Aruch HaShulchan that the Shulchan Aruch didn't say. Rambam didn't say that. This interpretation here is by Rav Michael Epstein. He's saying, if you are doing anything to hasten, moving the pillow under their patient's head, they'll lie down quietly, you're shedding blood means killing a life. And that's where, according to what Lawrence shared with us a couple of weeks ago, was when I said, well, you have to take off the ventilator. He said, not always, because we know there's a lot of Orthodox opinions out there that would say, we're not doing that. That'd be like shedding blood. We can't do that. Well, if we see that the patient is suffering greatly at the end stage of life, and we see that the death is preferable than the life for the patient, wow, we just said, if we see with our own eyes that this patient is suffering so much that we can actually determine and with reasonable and a good conscience say that death is preferable than life at this particular stage for that patient. Adele, you probably agree with that statement, right? Yeah, okay. We're not allowed to actively do anything that will hasten death, but the whole universe, now this is not Marshall speaking, this is the Aruch HaShulchan speaking, so don't think that I'm so smart. This is what his words were. The whole universe belongs to the Kadosh Baruch Hu. The Kadosh Baruch Hu. The whole universe belongs to him. So when we see a doctor, the doctor's doing treatment. He's doing the treatment because God is giving him the power and the ability and the knowledge and the seichel. He picked Dr. Rosenberg to give him that seichel that he could go to medical school and sit there and have the sitzfleisch to learn so that he could learn how to do what he has to do. He picked Dr. Bernie Schimmer that he'll become a pharmacologist and be able to teach other people organic chemistry in university, and they'll be able to learn exactly what the derivatives were, so they'll know exactly what treatment should be in that particular field. He picked, like everybody who has an ability in that field and a contribution to make is only because of the Kadosh Baruch Hu. And he says, this is what God wants. God does not want us to kill anyone, even if somebody wants to die. Well, that goes in line with what Lawrence said. We're not allowed to kill. And see, I have to keep track not only what my notes are and what I'm learning, but I have to keep track and make notes of who said what at what class on what day, so I can also remember what you said, so I can give you the answers. Who is to determine who is a ghost, as Rochama asked. So we got to get there. So anyone, if they're suffering greatly, they're really suffering greatly. Do you remember way back in one of our classes, I can't remember which one it was, but we talked about how the mitzvah, I said, of Bikur Cholim is way better if you can go in person, because on a Zoom or an iPhone or a telephone, you don't really see the sorech, the needs for the patient. You don't really know. So what does the Shulchan Aruch say you have to do for a patient when you visit them? Clean the room. Make the patient comfortable. See with your own eyes so you can see their face and see whether or not they're in agony. Then you can really sympathize or empathize with that patient. And it says, clean the floor, mop the floor for the person. Why does it say to do that? Because they can't do it themselves. Now, this goes back to a time where they didn't have people in the rooms coming in to clean up the rooms. You didn't do it yourself. They just didn't have it done. But, you know, if you can't see the patient with your own eyes, how are you really going to know what their suffering really is? Well, the Aruch HaShulchan continues and says, anyone, even if they are suffering greatly, and that is why we're not allowed to prepare anything for the funeral in choosing the casket or the white garment, the tachrichim, or anything, or make the arrangements until the funeral is dead. I had a phone call the other day from a man, and he said to me, will you do the funeral for my father when he passes? When is that going to be, do you think? I mean, I don't know. Like the doctor's telling you it's imminent, any moment. He said, in fact, I'm gathering my thoughts and I'm writing the eulogy. I said to him, don't write the eulogy. Don't write it. You'll have time to write it. Let's see, because we don't know. You'll write the eulogy, you'll speak from the heart. It's like you're already saying he's already gone by writing the eulogy. Don't write it. I still haven't received the phone call for that person. It's been 2 weeks. So they're not dead yet. So don't bring the casket in and say, look, let's make the funeral arrangements, because we don't know. Well, the bottom line is that our sources are emphasizing that there's a prohibition of taking an active measure, to doing something active that is going to cause death to occur quicker. But on the other side of the story, we're supposed to refrain from any activity which is going to prolong suffering. That's not actually mentioned, by the way, in the early 20th century sources. But I think Bernie will agree with me that medicine has moved a long way since the 1920s even. So Aruch HaShulchan is 1920s, 1910. Things have changed a lot since the 1920s. And from the 1920s to the 1500s, things changed a lot to the 1920s. But today we have a lot of advancements. I can't even imagine what they will come up with and have and be in another 50 years from now, in Yirtzeh Hashem. So if things have advanced so much, we move forward to one of my favorite poskim. I always say, if I could meet somebody, who would it be? Would it be Rav Moshe Feinstein? Would it be, right? And I always say, I think I'd love to have, I wished that I would have met the Minchat Shlomo, who is Rav Shlomo Zalman Auerbach, who lived in Yerushalayim. Rochaba, did you ever meet Rav Shlomo Zalman Auerbach? You did. You probably saw him. Of course you did. Lucky. So from Chelik Aleph, from the very beginning, in the first volume by Rav Shlomo Zalman, which I have to say, he edited himself for publication. So we know it to be the real deal, because a lot of the Minchat Shlomo, a lot of the what Rav Shlomo Zalman Auerbach we attribute to him as putting out in terms of Shelot Uchuvot and rules and paskening were published by his family after his passing. A lot of it came out later. It doesn't mean that it's not true. It doesn't mean it's not real. It doesn't mean it's not valuable. But when he did something and put it out and published it himself, it holds a different level. So he gives a scenario, and we'll have time for this one. And I am here, by the way, next Wednesday. I'm leaving to go up north next Wednesday, but I'm going to do a class next week. Faye's looking at me. No, we're not doing a class. I think we are. We have to do one next week. It's important. This is important because we're going to have to talk about Rav Moshe Feinstein, who gives a different opinion a little bit than Rav Shlomo Zalman Auerbach. Rav Shlomo Zalman Auerbach brings forth a case of a sick girl. And he says, he starts off with these words. Bernie, what are his words? In my
In my humble opinion,
It's what he says. He says, in my humble opinion, if the proposed surgery is undertaken, the best that we can expect will be lifelong paralysis in this particular girl. If the surgery is successful and saves the girl's life, she will be paralyzed for the rest of her life.
Oh my goodness.
Okay. In addition, the surgeons cannot guarantee that the surgery will even save her life. So two things happening here. Sick girl, three things. If we do the surgery, there's a 50% chance, let's say, that she's going to die during the surgery. If we do the surgery and she doesn't die from the surgery, she will be completely paralyzed, head to toe. But it will save her life.
But she has the choice.
She has no choice. The doctors have to make a decision. And the doctors are coming to the rabbi. And they come to Rav Shlomo Zalman Auerbach. And they present this case. Rabbi Shlomo Zalman, my daughter, God forbid, chas v'shalom, my wife, my mother, my family relative has to have a surgery to save her life. The doctors are saying, if we perform the surgery, she might die during the surgery. If we perform the surgery and she doesn't die, she will be paralyzed from head to toe. He says flat out, in a case like this, it is better to sit back and do nothing, not to operate. I found that shocking. Pekuach nefesh, save a life. But listen to this. He says, instead, depend upon God's mercy and don't let the surgeons treat her. So what is he saying, Rav Shlomo Zalman here? He's saying that if the best scenario, the best case here is going to be that she's going to be left with lifelong paralysis, then it's better to sit back and let the patient die. But it's not good enough to just give an answer like that and say, that's it. When you give an answer like that, you have to give an explanation. So here's his explanation. It's perfectly clear that the life of a paralyzed patient is no life at all as we normally think as life. The amount of suffering is great in the life of the paralyzed person, but also her family suffers greatly. Nonetheless, we are commanded by God and we are obligated to endeavor to stand up and do whatever we can to save the life of a paralyzed patient. For example, if the already paralyzed person develops an infection, for instance, of course, we're commanded to treat the infection and help the patient. But we are not talking here about someone who is already paralyzed. Now, that's my thought. That's not the thought of Rav Shlomo Zalman Auerbach. He didn't write that in-between part. He wrote the part that we have to stand up and we're obligated to save the life of the paralyzed patient. What I'm adding here is that if somebody is already paralyzed and they get a bacterial infection, we don't say, you know what? They're already paralyzed, nebuch, they got a bacterial infection. Don't treat it, let them die. You can't do that. One case is b'di'evid, the person is already paralyzed. The other case is lechatchila, the person is not paralyzed yet. You're going to perform surgery and leave the person paralyzed after the surgery. Lechatchila b'di'evid. It's a big thing in halacha. So we're talking about someone that if we perform the surgery, Again, now I'm back to Rav Shlomo Zalman Auerbach's words. And we're going to save her life. The best outcome, the best thing that can happen for this poor sick girl is if we do the surgery, the best scenario is going to be lifelong paralysis. Even if we would be Machalel Shabbos, so even if we were breaking all of the laws of Shabbos to save the paralyzed patient from any illness that she developed, we would do it. But we have no way of establishing the value of a life that it is of an infinite value. We don't measure their mitzvahs to establish the value of their life, even though the person's life is a great burden and great suffering for the family if we save this person's life. So if the person is already paralyzed, we're not saying, oh, it's a great burden upon the family. That's wrong. We don't do that. That's not Judaism. That's not the way we follow halacha. We're talking about a case where you will cause it. In any event, since the bottom line of the paralyzed person is bad, the bottom line person who is going to be left paralyzed is going to have a bitter life. Many of those people who asked the question, what about Stephen Hawking, what, John? Let me see what he says. Who made a decision? Is that what it was? Who made great advancements in physical without being, but I don't think he made a decision to become paralyzed. I don't think that was his choice.
No, but I think that he said, whose life is it anyways? It's my life, and just leave me, don't give me any refuot, let me die.
Right. I think that what we're getting at through Rav Shlomo Zalman Auerbach is there's a distinction between performing a surgery and causing someone who will become paralyzed to become paralyzed, or letting God take care of things, or simply treating someone who has already become paralyzed. If we're talking about treating someone who has already become paralyzed, this is a serious topic in the course of assisted suicide. They're already paralyzed. Then you have to treat that person if they have an infection, if they get a leg injury, if something happens, they fall on the floor, you have to try and do what you can to help the person, because Judaism teaches us that for Pekuach Nefesh, you can't say, oh, it's too big a burden. I can't travel to Florida. I can't go away on vacation to Bermuda. What a pain in the tuchus. This person is alive. Better they should be dead. That's not Judaism. We don't do that, right? We say, no, it's my honor to do for this person. But to make a decision. So here's the question, because somebody asked this question. I don't remember who it was. Tell me if you don't remember. You said, did we ask the girl what is her opinion? Rochama, did you ask that? Okay, you did. You said, what does she want? That is exactly where Rav Shlomo Zalman Auerbach went. Maybe you learned with him and you didn't tell me. I don't know. But that's exactly what he brings forward. He says that if you were to ask this person, you were to ask them, would they prefer to die at this point than to spend the rest of their life either, if they don't die on the table, they'll be completely paralyzed head to toe and never be able to move. So therefore, based on what you suggested, Rochama, and based on what Rav Shlomo Zalman Auerbach says in the Mincha Shlomo, he says, in the case that we're talking about here of the girl in question who is imposing a lifelong suffering on her life, in the case of doing that, there's no obligation to perform that surgery. Do nothing and let the girl die. Depend on the mercy of heaven, and all the more so in the case like this, which requires a major surgery And no one can even guarantee that the surgery will be successful. And no one can guarantee that the patient will even survive the surgery. If the patient wants to fight for their own life, then of course we will do everything possible to save the life. And it's a decision that has to be honored. So to answer your question, Rochama, if this person is able to ask, what will this surgery cost to me? And the person is able to make a decision for themselves and they say, I want to live. I'm choosing life. I want to live even if I'm paralyzed, I want to live. I don't want to die. Then we have to honor it. But here we are talking about a lucid patient. We're talking about someone who is seichel is working. They can answer the question. But what if we have a patient that is lucid and they say, nope, I don't want to live like that. I've had enough. I've had enough. I don't want to live the rest of my life with tubes stuck in me, paralyzed from head to toe. I'm not interested in that. To me, that's not a life. I don't want to. If we're talking about someone who cannot make the decision themselves, well, perhaps a little girl, a few months old. Can a 3-month-old baby make a decision for herself? No way. So if we're talking about a girl who's 20, 19, 18, 17, 14, 13, 10, 11, 10, 9, I don't know the cutoff. But if we're talking about a 3-month-old, a 6 months old, under a year, doesn't even talk yet, can't make decisions. You know, Rav Shlomo says that many people have great difficulties in making decisions for a terminal patient in a case like this, and it's really, really hard. Some people think that it's just as correct to violate Shabbos and Yom Kippur to save a life. Therefore, we have to be compelled to tell the patients and to help them and take whatever treatments are available. But we are not the owners of our bodies.
That's the key.
That's the key. And that's why, you know, we're not supposed to tattoo ourselves. You know, that's why, by the way, when somebody converts and they have tattoos, it's as if the tattoos are erased once they go to the mikvah. They don't exist anymore. They're there. You can see them with your eyes, but spiritually they're gone. Why are they gone? Because once you commit to Judaism, you're not allowed to, once you convert afterwards, go and say, after I've been to the mikvah, well, now I'm going to get another tattoo. Because once you've made that commitment to Judaism, you have to realize you are not the owner of your body. God owns your body. Only the Rabbanu Shalom owns your body. What seems reasonable to me, not to Marshall, but to Rav Shlomo Zalman Auerbach, I'm giving you his words here. If the patient is in great suffering, even if it's emotional, I think you have to give food and oxygen. Food and oxygen. Administering oxygen is, believe it or not, considered pain relief. If the patient does not want medicine which will prolong suffering, then they should refrain from giving it. If they are God-fearing, if they believe in God, we should explain that one moment in life, repenting one's sins and embracing Torah, one moment of life in this world is better than all of the life in the next world. We don't know that that's true. What Rav Shlomo Zalman Auerbach is saying is, if we say to the patient, hang on, try, do your best, because one moment of extra life here in this world is better than all the life in eternity. The only reason we're saying that is because we don't know what the next world brings. We don't know. We have to let that take care of itself. Our job is to do mitzvahs here in this world and let the next world take care of itself. You know, we don't focus as Jews as much. By the way, that's Christianity that was the first selling to Constantine by Paul, Jesus's disciple, that he had to go out and sell Christianity. That was a big selling point. He said, you know, to the Romans, you don't have to do this, you don't have to do that, you don't have to keep kosher, you don't have to put on tefillin, you don't have to circumcise. Just say you believe. If you believe in God and Jesus, you'll have eternal salvation. Wow. I'll live forever. They didn't want to die. They didn't want to die. Who wants to die? So this way, if you promise me eternal, that's why we try and be good boys and girls as Jewish people. We try and do mitzvahs because we're thinking, oh, I got another brownie point in the Olam Haba. You know, there's a sheet. I don't know. God has a big paper up there with a line. You did this. Oh, you weren't so good on that. You insulted that person. You take off a point. Oh, you get a point. You put on. Oh, you did. You did a mitzvah. I don't know. There's a balance sheet somewhere there. Mi yichyeh mi yamut, right? B'Rosh Hashanah yikatevu. I don't know. All I know is that if we are supposed to do our best to explain to people that one moment of life in this world is better than all of the next world, then that would be encouraging to help people want to receive medical treatment.
Right.
But ultimately,
I know a story, and you know this woman also. She was a member of our synagogue, and she suffered and suffered and suffered. And at the end, she said to her children, and you know them all, don't give me any medication. Just let me die. I would love. I had nice life. I had enjoyed my children. It came time that right now, genug is genug, you know, and they did it, and they did not give her a medication, and she passed away after a few days. And she wanted it. She really asked for it, and she said, "It's my life. I would like to finish," and that's it. And you know this woman.
And I think it's very fair, and I think it's fair, and I think it's okay when someone expresses that. But there's a difference, Rochama, between not doing anything and not administering extra drugs and not giving them things to prolong their life, or doing something that will be considered bloodshedding. So if I give you not passive euthanasia, but active euthanasia, I give you an overdose of morphine, boom, you're dead. If I do that, chas v'shalom.
No, this I would not do. No.
Right.
That's murder.
That's murder. So we have to be very careful of what we accept and what we don't accept. And again, I don't tell people what my opinions are. I want to give the opinions of all of the poskim so that you can make intelligent decisions based on that. So we will, it's exactly 10:15 and 31 seconds. We will join next week. See, I'm getting better at keeping on time because I tend to talk too much. Let's get together next Wednesday and finish up with this topic. In order to finish up, we have to go to the Igrot Moshe, to Rav Moshe Feinstein, and see why it's permitted to remove whatever it is that's preventing death, as long as you're not doing anything to actively kill the patient. He says it just like that, because it becomes a case of pain and suffering. And we'll go to the Igrot Moshe, we'll take a look at that, and that should continue, take away most of that. I mean, I have other thoughts on it, but I want to go to a different area of the same thing, which is the area of, it'll deal with the area of care of a cardiac patient, but really what I want to talk about is the obligation to heal and the prohibition to be healed. Who has the obligation to heal and who has a prohibition to be healed? It's a whole different area of the same thing. but it'll be hopefully of interest. And I hope that this today was of interest to some of you. And let's join again together next Wednesday, and I'll share some more of what I've learned so far. And I'm always happy to hear different opinions from you. You can email me or break in and say, you know what, I don't agree, as Lawrence will do often. And I'm very grateful to that, because I think that everybody has opinions and knowledge. So let's get together next Wednesday for some more of this and continue. Thank you for everyone for joining today. I appreciate it.
Thank you,
Thank you.
Marshall.
Thank you.
Marshall,
Yes.
it was like Bashert that I came on today because every single word applied to my husband, and
Right.
every last anyway,
Yeah.
it's not
And,
seven,
and,
but
and,
it
to, and
was-
to many of us too, Sandy, and I hope it resonates, and I hope that his name should be a bracha and a blessing, and as you're continuing to say Kaddish, that you'll think of him, and that we should all feel that we did everything we can for our loved ones, with the help of God's help, with God's help.
Yeah.
All
the
right.
idea, they said in that hospital that they're patient-centric, and he was in the ICU for 8 months. But the idea, even when you started about with shoulder surgery, back surgery, and things happen, you don't know why, but after 8 months, and then you don't know, because
Exactly. You don't know, and that's exactly right. And that's why I bring these words of the rabbis forward, so we can learn it together. Because a lot of these writings are only in Hebrew. They don't really have explanations. So that's why I notated everything, so that we could translate it in a way that would be plain language, plain English for everyone to try and understand as well. I have all the tshuvas in Hebrew. If anybody ever wants to see them, I have them. I have all the notes, but I try and make it palatable so everyone can understand. I think it's important. And it's an interesting topic.
yes, it is. Thank you.
They all are.
Thank
All
you
right.
very
Thank
much.
you. Thank you very much.
Bye-bye. Thank you.
Bye-bye.
Thank you.
Thank you. Bernie, Ellie, how are you?
We're good. We're busy.
We're busy.
Pamela's coming in from Israel with
Oh, wow.
Ophir.
Nice. For how
Yeah.
long is she here for?
A few days, and then they're going off to Vancouver because Ophir's family lives
Nice.
in Vancouver
Wow.
and in Israel. So it's sort of
Right. When is the wedding, or it was?
September 4th.
It's coming up.
It's coming up. So life is getting very hectic, but
Well, so
good
exciting.
things.
It
Have
is
to
good
grab-
things. It's great
Yeah.
things. Yeah. Wowee. Amazing, eh? Life is full of challenges and full of happy things and not great things, but we roll like roller coasters. Have you spoken to Jerry? I'll have to give him a call today.
I haven't spoken this week. I have
I
to
got a
call
phone.
Barbara
Yeah.
today.
We've spoken to Barbara, but not
Okay.
too much to Jerry.
Sometimes they
Yeah.
just can't come
He's
to the
sleeping.
phone.
Right.
Do you
right.
remember me?
Sandy? Yes. And we were sorry. Yes,
Yeah.
absolutely. I'm glad you're joining us.
Yeah, it
Very
was, but the doctors were saying, like, doctors have different opinions too. And the decision that you talk about what removing, it wasn't